Greetings, friends and followers. This is Nurses Talking. I'm Del Barzi. And as always, if you like what you see and hear, give us a like, subscribe. Let us know what you think. Leave a comment. Today, I'm speaking to Ms. Cheryl Cox. Cheryl is a registered nurse, behavioral manager for a large multi-state and actually international because they're, in Canada as well,
Yes.
large healthcare company. So welcome, Cheryl.
Thank you. Thank you. I'm happy to be here.
I'm happy that you granted me the privilege of having a conversation with you.
No worries.
So, first of all, how are you?
I'm good. It's been a busy March. It's been a very busy March. So I'm just happy that all things have subsided, and I'm doing great.
Okay, great. So, I usually want to know why people are nurses. So, why are you a nurse? What inspired you?
This is going to be real crazy. When I was about 5 years old, my cousin, who is maybe about 10 years older than me, she used to candy stripe. Now, I don't know if they know what candy striping is. I was born and raised in New Jersey, and they had, for the weekend, she would do candy striping. And she had on this uniform with the hat and a red and white bib, white
Yes.
skirt, shoes, and socks. And I asked my dad, I said, "What is she doing? What is that?" My dad said, "She's a nurse." That was it. I wanted to be a nurse from that day because I wanted to wear the uniform.
And it never changed?
It never changed. And it's so crazy as I got older through the years, because I fell in love with Ben Carson, because he was the one who separated the Siamese twins,
Yeah, yeah.
I wanted to be a brain surgeon. So it was going to be medical no matter
No
what.
matter what,
And it
right?
ended up being nursing, and I'm glad it ended up being nursing. That
Right.
was it from 5 years old.
So, from 5 years old, you've had this dream to be a nurse. When you got to nursing, got through nursing school, got to nursing, did it turn out to be what you thought it would be?
It turned out to be even better than what I thought it was when I first started nursing. So you
Okay.
have to remember, I've been a nurse since 1990.
Okay.
So we're talking about a long time here. I know I look young, but
I'm going to
I've
laugh
been
at you because I've been a nurse since 1974. So
there.
now.
Well, you look so good. So in 1990, when I got out of nursing school, I was recruited by the ICU manager because I did internships over the summer.
Okay.
So I left nursing school and went into a ICU immediately. And it was everything I wanted it to be. I had some of the best preceptors and lessons that I learned then. I try to carry over to my nurses now because it's lifelong lessons. And the main thing they told me, this is never personal. This is always business. Focus on what you're doing and take the best care you can
Yeah.
of your patients. And you can't put your emotions in it, worrying about what somebody else is saying or what somebody else is doing. You stay focused on what you're doing, and you will always be, happy in your job. And I have been. I don't know what else I could do if I wasn't a nurse.
Well, that's a question I would have asked, but okay.
Yeah, I don't. I really don't. I've thought about it. I've really thought about it, and I was like, what else would I've done? Like, what else would I have done? Because my focus is really in serving and in educating, and so maybe I would have been a teacher, but it definitely would have been in a service field.
So what are I know nobody gets to be a nurse, and you've been a nurse since 1990. So no one gets through all of that without some challenges. So what were yours?
Most of them were this is the God's honest truth, that dang blasted computer. Oof.
When you
If I
went
have
from
never told,
paper to electronic.
I was the last class that did it on paper. If I can get rid of that computer, because I tell them all the time, listen, I went to nursing school before computers came out. Somebody help me, because I don't know what you're talking about. I know how to do my work, but don't ask me to do nothing extra. that has anything with me programming anything. It's not going. I'm about to call one of my young nurses, like, hey, come give the old lady a hand. And they just laugh at me. It's not that hard, Miss Cheryl. Yes, it is.
I know that feeling. Well, of course, I know that feeling.
Yes, ma'am.
EMR is like, it's totally foreign language when you first,
Right, right.
when people start introducing this to you, and people introduce it to you, it's always these techie types, who speak like you're supposed to know what they're talking about. It's like,
Right,
what?
right.
Slow down, please.
Right,
Stop,
please,
stop.
please.
So,
What button? What button?
yeah, exactly. And I have this thing, I say, it's really simple. And no, it isn't.
No, it's not.
I feel you, my dear. So other than ICU, what other areas did you work in?
Well, when I tell nurses, listen, this is the field where you have a gamut of opportunities.
Yes,
Don't get stuck in one area.
exactly.
My resume reads as a booklet. It really does. I went through ICU. I left that. I came to North Carolina from Jersey, and I worked in a cardiothoracic unit. I did that. I did cardiothoracic step down. I even went into the prison system and worked as a supervisor and manager in behavioral health. And that's how I got introduced into behavioral health.
Okay.
Was from North Carolina. But in between that time, I ended up doing travel nursing. So I said, I want to travel. So I did travel nursing. I was on Life in the ER, shock trauma in Baltimore with the little pink scrubs. Of course, you just saw my back going down the hallway, but I was on it. I said, my back right there. So traveling was wonderful. Oh my God, that was an experience. I really loved traveling. And then I came back and started to dibble more into behavioral health, and that's where I landed for since about 2000 and I want to say 2006, 7. I started doing behavioral health. And when I came to Georgia, that's what I continued doing with doing behavioral health.
Okay, so two things I want to ask you. Well, I'll come back to traveling in a minute, but it's a home care agency you work for now.
Yes.
And you're doing behavioral health. You are a regional manager.
Right, for Georgia and Tennessee.
So what does that entail?
So what it entails is that, okay, so we have geriatric population. A lot of the geriatric population are living longer. They're having late life depression. They're having late life anxieties. They are being transplanted from one state that they lived in. Their kids live someplace else, right? So they're being transplanted now where their kids live. It's, they're having hard times transitioning into the new environment.
Yeah.
And that's where we come in. As a home health agency, we are, it's just like a visiting nurse type situation. Yeah. We are contracted to go in and provide late life education for depression, anxiety, caregiver strain, because you have family members that have dementia now. Those loved ones are older. So we teach the caregivers how to effectively care for these patients with dementia and Alzheimer's. We are there for, if you move your parent into a nursing home, we come in and help them transition through, because for the most part, you're at work. Yeah. You don't have the opportunity to go see mom to make sure that she's going to the bingo game, or she's coming out of the room and making sure she's eating, she's interacting and intermingling with the environment. So we come in and we provide that transition for that family member to get them acclimated to their new environment.
Awesome. And the thing is that, also, because people are living longer, the caregivers are older.
Yes.
Yes.
I mean, they're at retirement age themselves most of the time, and they're working through, getting ready to go into that next phase. And then you have mom who's 80, 90 years old. And listen, these women and men are getting around better than some of us young ones. It's just that we have to teach them now how to have a life in a new area, in a new state, in a new place. So that's where we come in at.
Yeah. Yeah.
But we also provide, like I was telling you to do, and just not behavioral health, we provide, we do a holistic approach. We have therapists, we have social workers, and we have medical nurses,
Yeah.
so we do it all actually.
Yeah. 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 So you mentioned travel. That was the thing I wanted to ask you about. So you enjoyed the travel nursing thing,
And I love it.
but nothing comes without some cons. So if you had to give advice to someone, because traveling is big now,
Yeah, it's huge.
traveling is huge. So what advice you give to someone who wants to travel? How should they prepare?
My advice to them would be, don't get involved with the hospital politics, because you don't have to. You don't have to get
No, you
involved
don't.
with
You don't belong there.
politics.
Mhm.
Don't let them bring you and do your 13 weeks or your 26 weeks,
20.
however long you're going to stay, and focus on what you're there for. You are not a part of, you're not going to be a part of the solution, what they have going on, because you're there to help and fill out while you're there.
Mhm.
Stand your ground. If you feel like you're being taken advantage of, you definitely speak up. Because you are the traveler, they will try to give you the worst assignments until they get to know you. And it's definitely a what do you call that? Initiation. They
Uh-huh.
want to see how well you're going to work before they start to, you know, come around, and because a lot of times they're angry because they think you're making more money than them, and
Which you
you
are.
well, you are, because I'm displaced. I'm not at home,
Exactly. Exactly. And that's some of the cons too.
yeah.
Yeah.
And so, and just negotiate for yourself. Really negotiate for yourself and get yourself a 1099. Make sure you have that. Make sure that you're taking and setting money aside for your taxes, because
Yeah.
it will hit you in the end. It will definitely hit you in the end if you don't pay attention to that.
I ask nurses this all the time. What would they like to see change, if anything, about nursing life per se?
I wish we would get back to not being so corporate. I want us to get back to being Florence Nightingale-ish, Dorothea Odom-ish, Orem-ish,
Yeah.
those
Yeah.
theorists who thought about what it would take to give a holistic approach to your
Yeah.
patient, right?
Mhm.
How can we cure them from this? I can't cure them knowing whether or not they're going to be able to make this payment next week. I can't give them the care that they need because somebody's rushing them out the hospital because their insurance is only going to pay for 3 or 4 days in the hospital.
Yeah.
Those days,
I know.
right. We had patients in the hospital sometimes 3-4 weeks until we can get them to the place where they can actually go home and function. These patients are coming out the hospital sicker than they went in.
Yeah.
And the nurses in the hospital don't have the opportunity to really even, you're not Mr. Johnson now, you're room 325. Back in the day, that was Mr. Johnson.
Yeah.
Mr. Johnson is in, he's having this, he's having that. Now, the patient in 425 is such and such and such. We no longer have names now. We've gone to, room numbers. And the compassion is not there. And I'm just being honest. I think a lot of, and I don't want to offend anyone, but I know when I went into nursing, I didn't go in it thinking I was going to get rich, because nurses that I knew
didn't get paid much.
They weren't rich. They had jobs, and they always had a job, but they weren't rich. They were living, a comfortable life. Nowadays, these nurses are getting rich.
I know.
They're getting rich because their focus is on the monetary portion of it, and it's not so much on the actual care, the advocacy. I remember back in the day, a doctor couldn't tell me to do something that wasn't right. I would question him from head to toe, like, sir, no.
And you're expected to.
Yeah, I'm like, sir, no, I'm sorry, but we're not going to be doing that because this, and this. And then I can justify why we're not going to do that. And I'm going to advocate for my patient and that family. I have nurses now say, well, that's what the doctor said. And everything inside me just balls up. And I'm like, I don't care what he told you. What is the right thing to do? Advocate for your patient. You're the one with the patient more than the doctor. He doesn't know these things that you know. Are you even giving him that information?
Yeah.
So that's the only thing I want us to go back to being nurses and not business managers of patients, but advocates for patients.
Yeah, I know what you're saying. I just said that to someone the other day that we have come, and I don't know if it's anyone's actual fault per se, because when you go to nursing school, nobody's talking to you. You're not, your mindset is not a corporate mindset. In nursing school, you're talking about caring, you're talking about all of these
Right.
kinds of other things. And then you come out and you get into this atmosphere and it's totally corporate. You don't even know what this is. It's
You
like
don't know what
somebody
it
dropped
is.
you in the middle of an ocean,
Yeah.
and you can't swim.
Yeah. And I
You
say that
know?
all the time. And I look at myself up as corporate as I am, I try to maintain some of my nostalgia
Yeah,
and try to be more hands-on,
yeah,
and I have to tell, even though I'm not doing patient care, I tell my nurses that I'm your advocate. So you guys are like my clients and I'm
yeah,
your advocate. You tell
yeah.
me what it is that you need and I'm going to advocate for you, which is in turn going to what? Give you what you need
You
to
need
take care of my patients.
and to advocate for your patient. Yes,
Right.
exactly, exactly. So, what would you say is your greatest achievement as a nurse so far?
My greatest achievement as a nurse is the amount of nurses that I've mentored to go on to be nurse practitioners, PhDs, the support that I provide to other young nurses. You know, I can look at somebody and I can say, wow, you're gonna be great if you just did this.
Yeah,
And I can say that I have mentored a lot of young nurses, and most of them now have more degrees than me.
that's
They have
okay.
more they have more degrees than me. And on top of that, they are good nurses. They're there for the advocacy. They understand the assignment,
Yeah, yeah,
and that's what I like to see.
yeah.
I definitely feel that's my greatest achievement is that I'm making sure that the right people are taking the right steps to follow in the legacy of still making sure that nurses are considered caregivers.
We hear a lot, I hear a lot these days about burnout. Everybody's talking, burnout is, the second word on everybody's lips. Do you think we can do something about this?
I
First of
think
all, do
work
you think we even recognize it in time?
Yes, and I can say that for my company because we just did this thing called Reimagine, and we
Okay.
reimagine our healthcare setting, and we want what we call pajama charting. I don't want the nurses to go home and pull up their tablets and chart all night long till 10 o'clock at night. Then you got to get up in the morning and go out and see
Do it
patients.
again.
What we did was we cut down on the way we structure visits, and we cut down on the amount of visits that we're giving each nurse. So we hired more nurses, gave them less patient load, and
Mhm.
the turnaround has been great so far. We've just implemented this in January, and right now, here we are in the beginning of April, and I can say we can see the enormous turnaround in documentation, productivity, work-life balance. All of those things have come to fruition, and it is actually working. It's actually working. So we split up um, the caseloads so that people can actually, you're still productive. If you choose to do more patients, then that's a choice. But we are making sure every day we look at the schedules, how we schedule them out, and how many patients each clinician has to make sure that they meet that criteria for productivity, but also they have work-life balance.
Awesome, awesome, awesome. And it's very, it's good that you were able to measure those things.
Yeah, we
And see, yeah,
definitely did. It actually we actually were the test pilot in Georgia. So the agencies in Georgia, we were the test pilots, and we did really well. They were very pleased with how we were able to maneuver and manage that. So they moved it on. They just doing it around the country now to all of our
yeah,
offices. But we
yeah.
were the test pilot, and it turned out really well. So far as from the feedback that I'm getting across the country, is doing really well. People
Awesome,
are receptive to it.
awesome, 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 awesome. The other thing we talk about a lot, and the other thing I when I speak with nurses, I ask about this. And I stress about it because of, we are by nature caring people, and we tend to want to care for every single other person. What
Yeah.
about self-care? And what does the self-care mean to you?
Self-care is important to me. Self-care is important to me because I believe in self-care. I don't know if you've ever seen this movie called was it The Five Heartbeats?
No, I
And you
haven't.
never say it was the Five Heartbeats, and this guy came and he said, "Hey, I wanted to talk to you." And the guy who was the person he was talking to was a unscrupulous type of guy.
Yeah.
But the guy said to him, "I'm busy. Don't come bothering me right now." He was like, "No, I want to talk to you." So the guy and his goons, they just roughed the guy up, and he said to him, "My office hours are from 9 to 5." And he said to him, "What did I say?" He said, "Your office hours are from 9 to 5."
Yeah.
That's me. My office hours is from 8 to 5. My office hours are from 8 to 5. And unless it's an emergency, your emergency with you or a patient or something like that, please give me that respect. I got a 16-year-old who demands my time.
That's good though. That's good though, because we tend not to give ourselves the time we need.
Yeah.
End up you're just exhausted all the time and forget that you have another life.
Right.
In fact, several other
Several.
lives. You
Several.
know?
I have a nurse who he was so burnt out. And I looked at him one day and I said to his manager, I said, "Give him Friday off." She said, "Why?" I said, "Look at him. He's frazzled. He's not gonna do it if we don't take
Yeah,
care of him."
yeah, yeah.
So she called him in the office. She was like, "Would you like to have Friday off?" If you could have saw his face, he was like, "Really?" She was like, "Yeah, I think I got somebody that could cover you on Friday. Why don't you take Friday off and you know have a long weekend?" Did not know that it was his wife's birthday that weekend. We had no clue. But I just looked at him and I said to her, "You need to give him Friday off because he's not looking too good right now. And the next thing we know, he's going to be sick or he's going to call out or whatever." He came back on. Listen, it was so he was so grateful. On Monday morning, we got a box of cookies. I was like, that's the last thing he needs to be sending his office, a box of cookies. But he sent a box of cookies with a thank you note saying thank you for recognizing, and I tell the people, my people that my coworkers that are, that report to me, look at your client, look at your patients, look at your staff as your clients.
Yeah.
If you
Yeah.
went into a patient's house and you saw that they so disheveled or you would want to give them a break, right? Like look at your staff that way. You have to send them notes and say thank you.
Yeah.
It doesn't have to be anything they did. Just thank you for getting up and
And
deciding to go
showing
see
up.
patients today. I appreciate that, because there's a lot of people who don't want to show up and just don't. And then when you have loyal employees, you have to reward them. And one of the things I try to teach my staff over and over again, focus on the good employees. Don't utilize your time on the employees who are subpar. You're going to have to deal with them. But what normally happens is your focus is so much on the subpar clinicians, that you don't focus on your good clinicians. And then your good clinicians are like, well, hell,
I'm like,
I'm doing a good job over here. Don't nobody pat me on my back, but you're constantly, doing something with
mhm.
this one. So you have to be mindful. I took a management course, and that was one of the things they stressed. Reward your good clinicians. Make it a habit to always reward the ones that are good and make them feel that you understand that they're doing a great job. And then you try to, because that's an example. We all got subpar clinicians, right? The subpar clinicians will start to see that praise going to these good clinicians, and they might want to get some of that.
Mhm. Yeah.
They might want to get some of that, and they might start behaving well. But if reversed, if you give all attention to the subpar clinicians, those good clinicians might start being subpar. Now you got a whole problem. That's a whole other ball game. So
Yeah. Yeah. You've got to give people something to aspire to.
right.
Yeah. Yeah. So, Cheryl, I'm collecting these words about nurses. I want to know what started me asking this question is I wondered what we see in each other as nurses. And so I want to know if you had to describe the most essential quality of a nurse in just one word, what would that word be?
Compassion.
Compassion. That word comes up a lot. That word comes up a lot.
Because if you don't have it, you're not going to be a good nurse.
Yeah, yeah. And you know that compassion, and we were just talking about self-care, but that compassion has got to extend to yourself. Because sometimes, very often, you find yourself in deep water, and you know, gotta give yourself a little breather, a little bit of, yeah. Extend some of that compassion to you.
Right.
So
That is so true. That is so true. I know nurses who've never taken a vacation. And then they ask me, well, you're never at work. Well, they gave me vacation days, and unlike you, I'm taking mine.
You know, I have never understood that.
I like to be going.
When I see people, I said, but if at the end, you know, on payday, you didn't get paid, you would make a fuss because you earned this money. Well, you earned the vacation. So why aren't you taking it? You know, it's something you earned, just like that you earned the money, you earned the time. But I've never understood that.
Never an issue for me. Winter time I can work. I work all winter, but the moment it get hot outside, woof. The moment it start getting warm, I got to be somewhere. I don't know where it is, but I got to go. My coworkers laugh at me so much. They were like, how many vacation days do you have set for the summer? I said, well, I think I'm gonna be out of town on this week. And you know, depending on who called me on this day, I might be out of town on this week. But I encourage them, take some time off. You got to get away from it.
Yeah.
It is overwhelming, and COVID just added more stress onto it. More stress. You got to get away.
Yeah. That COVID says you can't even quantify it. You know, I mean, every time I think that I see what people are going through, the more spills out. You know, you can't even quantify it.
Those frontline nurses, man, they have it hard.
Yeah.
I feel for them. I really do. I really feel for them. It's those 2 years have been crazy. It's the worst I've ever seen. I'm only 55 years old, of course, because I haven't been around 100 years to see what it was like before. But this is the first. Now, working in ICU, I've had epidemics. I've had SARS. I was working in ICU through SARS, through the bird flu, through N1H1, H1N1. I was on the front line with those things, but it was never
like that. Not like
my
that.
God.
It's not like that. You know, even with things like SARS and stuff like that, in short order, you knew what you were dealing with. You know, but it was so long before you had any idea precisely what you were dealing with, so you could even pin down. Do
we even know now?
So there you go.
Do we even really know now?
No,
we don't know.
No.
We have no clue. We have absolutely no clue.
So a lot of people were just working blind, you know, well, here we are. So what doesn't kill you makes you stronger, I guess. So let's see.
Makes you stronger.
So let's see.
Yeah.
Cheryl, I'd like to thank you for talking to me today.
Oh, I appreciate you having me.
It's been an absolute pleasure.
Yeah, me too.
We bounced back and forth a couple of times. We finally got it together.
Yeah, that's okay. You listen, like I said, March was a humdinger. The humdinger. So I'm happy that we were able to do this, and I'm really, you know, I like what you're doing. I think it's important to, you know, hear the nurses' voices across the country. We hear nurses now. I mean, for a long time we've not been to the forefront. You know, we've not. This has brought us to the forefront, and we need to take advantage of the things that we need.
Yeah.
as nurses.
Yeah.
We need to start opening our mouths about what we need as nurses.
Yeah.
You know, we're on the front line. You guys think that the doctor is not on the front line.
No.
You know, he's not there. We keep you alive. You know, we're the brunt of the anger from the families. You
Yeah.
know, we get the
Yeah.
trays thrown at us because we want you to take this medication, you
Yeah.
know. You
Yeah.
know, we're called, you know, idiots and all
All
other
kinds
kinds of
of things.
names,
Yeah.
but we're keeping you alive. But you give praise to the doctor, and not to take anything from the doctor, because hey, they're the
Yeah.
diagnosticians, they have to diagnose and they have to do those things. But give us credit, give us our just desserts, give us our roses while we are still here, and thank a nurse. You know, thank that nurse, because
Yeah.
if not for her, some of us may not be here. And some of your loved ones may not still be here if not for her.
If not for them. Yeah.
So,
Yes.
or him. Sorry, I don't want to, him or her. I love my male nurses. Don't get me wrong. I love my male nurses. The best thing that ever happened to nursing in my eyes was when we incorporated men into the
Yeah.
fold.
And made it more.
I feel that wholeheartedly.
Yeah. 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 And you know, as you talked about, you know, giving us our props. That's really what one of the things I want to see us do. I want to see us demand our props, really.
Demand.
Step up and show that we are here. You can't function without us, right?
Let every nurse walk off that hospital.
You need to listen to what we have to say. I need to see us put ourselves in the forefront, because you know what? Nobody's going to do it if we don't.
Nope.
And they don't have to. They don't have to. The onus is on us to put ourselves out in the forefront.
And as nurses, we need to support each other as nurses, because you know, as nurses, we eat our young. We'll chew them up and spit them out. I mean, chew them completely up.
That keeps coming up.
And spit them out. We have got to be better. We have got to be better to the young ones coming in. We've got to, because if we don't, it's going to continue the way it's going, and it's not going to be for the better.
And so I wonder, because as I just said, that phrase, you know, once you step into nursing on any level, you hear it. Nurses eat their young, but it keeps coming up, and I wonder why. Where did that stem from? What is it about our job, or about? It's not about our person, it's about our job or about our situation that makes us so, that can make us so intolerant to other nurses.
Nurses are the most arrogant people on the planet. We know everything. Your doctor don't know nothing. Listen, I just sat here and said it. Your doctor don't know nothing. I know everything. I'm going to keep you alive. And I don't got time for this new nurse over here who's going to talk to me about a book. You throw that book to the side. That book is not real life. That's what it is. We're so arrogant. And that's something that we have to admit. We have to admit our arrogance is what makes us eat our young. She don't know anything. No, I'm not. No, I'm not today. I'm not precepting anybody today. No, I can't do it. But instead of embracing it and saying, let me take this one under my wings and let me show her how to be a great nurse. We sent them off packing. No, I can't. And listen, I'm guilty of it. I've worked in a hospital where I've had the nurse manager call me on the phone and say, can you explain to me why she's down here crying? I said, because I asked her to do something she didn't know how to do, and I told her to go to the office because I don't need her today. Listen, I know it. I know what I've done. And I sat back over the years and I thought about it. It was like, you know, that was horrible, because nobody did that to you. Well, I did have one nurse do it to me, but I, you know, me being who I am, I hit her back. I gave it back to her. And then after that, we became the best of friends. But, you know, we eat our young, and we really do have to stop. It has to start with us. We have to be the change agent to make sure that we nurture these people, men and female, that we nurture them and we give them a good, you know, we give them a good example of what it should be.
Yeah. And to be fair, there are some nurses out there who are doing just that.
There are a lot. There are more
many nurses
doing it than not. There are.
doing just that. It's just
Yeah.
that it's just like life, you know. The bad experience gets magnified.
Exactly.
But there are many nurses out there doing just that. But yeah, it comes up all the time.
We are horrible. We are horrible. But you know what I've noticed? We don't treat the male nurses like that.
Well, they're not going to stand for it.
Maybe that's it, but we
They're
do
not gonna
not
stand
treat the
for it.
male nurses like that. And I've witnessed that.
Yeah, well, they're not going to stand for it. And that again has to do, I think, with the fact that we're still, as much as we think that we have progressed, we're still very much a patriarchal society.
Yeah, that's
so
true.
you know, our view on our interactions with men is different to our interaction with other women.
We have to do better.
Yeah,
we have to do better.
Speaking of male nurses, I'm beginning to see, and I'm happy to see, that we're actually stop referring to them as male nurses. Now we're just going with the nurses thing. I like that.
Yep. I like that too.
I like that. Yeah.
Yeah.
Thank you so much, Cheryl. It's been such a great conversation.
Yes,
thank you
please,
so much.
Thank you. I appreciate it. Have a good weekend.
You too, my dear.
All right.